I think the fundamental question that I'm looking at now, returning, to New York and comparing this health reform debate, is what is the function of healthcare, or what is the function of the healthcare system? Now, in these countries that score really high on the list, the point of the healthcare system is to keep you healthy.
Right.
And doctors are paid to keep you healthy. Let me give you just two examples that would just blow you away. For example, in Austria, every neighborhood has something that it's called a Notarzt. It's an emergency doctor. For example, I got a bladder infection. It was a Sunday. I was in a lot of pain, and I didn't want to get up and go to an emergency room. I just wanted to be sure that's what was wrong with me. So you just make a phone call to your neighborhood doctor. The doctor comes to your house.
Oh.
They did a urine test in my bathroom, found out it was a bladder infection, gave my husband a prescription, they left. The whole thing is free.
Yeah.
Now the option here is like I could have gotten in utter agony, waited if I didn't have health insurance, gone when the problem had gotten much more severe.
Right.
It would cost much more going to a hospital. And so just something simple as that, you would think, wow, a doctor comes to your house, but actually this is preventive, and this really helps. Another example is they have something called a Kur, which is cure. And that means that if you have something and that you think that you just really need to get away for 2 weeks and get some kind of rehabilitation, you can do it. A friend of mine who's the same age, big smoker, very big smoker, I'd get together with her and she would cough, and I think this woman has 5 years left. She applied to have a Kur. She was accepted. They sent her to a very nice resort. She took classes and she learned how to stop smoking. She hasn't smoked now for 2 years.
Okay.
And that woman just added 10 years to her life. And
At
she
least.
decreased a lot of medical expenses. So these are preventive things. Now, when you look at the United States, it's like 75% of the $2 trillion that is spent here is on chronic illnesses. It's on cancer, it's on diabetes, it's on heart issues. 75%. If there were more effective disease management programs to help people, preventive programs, this is the kind of thing that's focused on in other countries. It's not rewarding doctors when you're sick, it's rewarding doctors when you're healthy.
Right.
What would you say is your experience here?
I think that that's very true, and I have had to go to a separate doctor and a separate provider and pay completely out of pocket in order to get that kind of preventative care, in order to say, instead of going down this road of being progressively sicker and sicker, one of our problems, of course, is much of our healthcare system is controlled by pharmaceutical companies and by that whole arm. And so, with your doctor, when you go in and you're insured with the government, it's a quick diagnosis, as quick as possible, and what pill can I give you? And the problem is that cure causes other problems, and pretty soon you're down the road with, I have a friend who's now went from one autoimmune disease to 5. And she's on 21 different medications. And there's no way that she can recover when she's putting all of that poison into her body.
Well, that's a really good point. And you actually hit on something that for me is just making me nuts over here listening to this debate on healthcare. And that is the power of the pharmaceutical companies. For example, Obama's plan. I mean, if there really is a plan there, it seems to be some mixture of the public option competing with private health insurance, which makes basically no sense, as far as I can see. But the bottom line is on May 11th, there was this huge press conference with Obama and these representatives from the pharmaceutical industry and also the healthcare industry. And they were, the whole thing was just a joke. And they were saying, okay, we promise, that we, over the next 10 years, will decrease Americans, costs by $2 trillion. Which makes you ask some fundamental questions.
Like, why haven't they been doing this
a
long time? It's not like we started talking about this as soon as Obama got elected. We've been talking about health reform for decades.
So for one, why haven't they done that? For two, as if we're going to believe that. I mean, they said that back in the Clinton years, But for me, for three, Why is Obama standing with those people? Why is he not standing with doctors and nurses who are advocating other programs, you know, single health or something like this?
So sick folks.
Yeah, or people who are sick and can't get care. You know, I mean, this is democracy. These are the people who need it. And then for me, the whole thing was just gelled during the Senate Finance Committee, the same month, I believe. I don't know if you remember that. There were 50 people who went to the Senate Finance Committee who were talking about health care reform. And what I should say is this was a round table. And it's chaired by Max Baucus of Montana. Now, this guy gets 23% of his funding donated to him by the pharmaceutical industry, by the healthcare industry. The number 2 guy, Grassley, also, he's the ranking Republican. He gets 23% of his funding. And so both of these men from the pharmaceutical industry and healthcare industry, and both have said single payer is not on the table. Well, yeah, why should it not be on the table? It's because they're going to lose their cash, you know.
Right.
So at this one finance meeting, 50 medical professionals went, and first there were 40 nurses that stood up, and they had just little signs. They were silent, and they said, today is Florence Nightingale's birthday, and we think that at least one representative of single payer should be at this table.
Right.
And then one by one, the doctors and the nurses stood up and said, hey, I'm Dr. X, I'm from this community, and I really believe we need to open up the debate on this. And the senators had them thrown out and arrested. You know, I mean, this is not much of a level of openness and democracy, even in defining the legislation. And finally, what's just making me nuts is that of the lawmakers writing up this healthcare legislation in the U.S. right now, 30 of them have massive investments in the pharmaceutical industry. For example, John Kerry and his wife have something like $5 million invested. And so for me, the whole concept of how the pharmaceutical industry is defining and limiting the very scope of discussion is just not acceptable, and it's going to lead to something that is not good.
Yeah, and with the help and the support of the administration.